Well, hello everybody out there, and I'll tell you, this has been quite a day. I have this beautiful man on the on the end of the line. His name is Charles Clarkson, and I want him to come on and tell us what he does. Hi there.
Hello, how are you?
I'm fine. I'm so fine to talk to you. Tell me, what is it that you want to spread the news about?
Well, I am the project director of a federal program called the Senior Medicare Patrol. Every state has a Senior Medicare Patrol, and I happen to run the one in New Jersey. And our mission is really quite straightforward. It's basically to educate seniors about Medicare fraud, waste, and abuse so they will not be victimized. And we do this by going out and doing presentations throughout the state. And we also do Zoom calls. I was on one this morning giving a presentation to social workers at a number of senior residents. And we also have a newsletter. And basically, our mission comes down to three words: prevent, detect, and report. Now, people don't realize how much fraud there is in Medicare. Medicare loses between 60 and 80 billion a year. And you know who pays for that? Everybody on your call pays for that because it comes out of our tax dollars. So there are a number of things we want to educate people about so they will not be victimized. A number of rules people should follow. Number one, they should always protect their Medicare card because that Medicare number has value. You know, 5 years ago, there used to be the Social Security number on the Medicare card. Well, they removed that and put in the randomly generated numbers and letters so that we can help prevent fraud. But it doesn't help if people basically give out their number to strangers or fall for scams on the telephone asking for their Medicare number. So we want to make sure that people always protect their Medicare card. And I will, Jeanne, that probably everybody carries their Medicare card. They shouldn't carry their Medicare card. They don't need it when they travel. You know, people always ask me, well, what about an emergency? I won't have my Medicare card. Well, let's give an example of an emergency. Let's say you're on the thruway and you're in an accident and you're rendered unconscious. You know what's going to happen? The police will come, an ambulance will come, and they'll send you to the nearest hospital that can treat you. Do they check you to make sure you have health insurance? Of course not. You could always give them the information later. So I urge everybody, leave their Medicare cards at home. Put it in a safe place. Only take it with you when you go to the doctor, when you go to the hospital. And when I say leave it in a safe place, I mean don't hide it where you can't find it. That basically makes no sense. So please protect the card at all times. And people don't realize that when their Medicare number is compromised, not only does it affect Medicare, but it affects them. You know how people find out they've been scammed by Medicare? Let's say to go in and do a preventive test. I'll give an example, like a colonoscopy. You go in there, you get the test, the claim goes to Medicare. Medicare says, we're not paying. And you say, what? I have Medicare. They're supposed to pay for this. Well, someone already got the test using your Medicare number.
Oh, wow.
To get one every, 5 years. And then you realize your number has been compromised. So we get these calls all the time. And people ask me, well, what do I do? Well, because Medicare changed the system and gave out new numbers, if you lost your credit card, you would call up the company, and the credit card company would send you a new card with a new number, right? Well, we can now do that. Now we can do that in Medicare. If you go and call up Medicare, you have to do this personally. They won't let me do it for you. If you call up and say, my number is compromised, hey, we'll give you a new card and a new number, and you can start using that. And the old number is canceled, so it cannot be used now to cheat Medicare and to cheat the individual beneficiary. So that's just one of many things we want to teach beneficiaries, you know. And of course, the biggest thing what people have to do, especially seniors on Medicare, they have to read their statements. If you don't read your statements, they're going to get away with it. Any error, any fraud, any abuse, because if you don't report it, then Medicare pays them.
Yeah.
So the most important part of prevent, detect, and report is report. Because if you don't report it, then Medicare has no way of knowing it's fraudulent. So please, everybody out there, if you think that you've been cheated in Medicare, you can call up the SMP in your state, whether it's in New York or New Jersey, and they're free. These is a free program. They have volunteers, and we have lots of volunteers, and we assign a volunteer to that individual beneficiary to help them resolve any Medicare issues.
And if you wanted to get the telephone number, what do you do?
Well, you can go on there is a national website, and you can look up your state number, and it's smpresource.org. That's S as in Sam, M as in Mary, P as in Peter, resource.org, and you can look up your state number and call up the Senior Medicare Patrol in your state, and they are basically funded to help seniors resolve Medicare fraud issues.
Mm-hmm.
So, and then what we always educate people about are scams. Scams proliferate all over the place, and being knowledgeable about what to expect and what scams are out there will protect you. So I'll give you an example. We've gotten a rash of calls lately about people being sent urinary catheters that are not medically necessary, not approved by their doctor, but it's sent to them because someone has their Medicare information and now will bill Medicare for those urinary catheters, whether or not they are delivered. So those are the kind of scams we are seeing. And a big one that we see all the time, and has been going on since I started here many years ago, is genetic testing. People get emails, texts, saying your doctor ordered a genetic test for you. I'm putting doctor in quotes because obviously the doctor didn't do that. And genetic testing, although in rare circumstances is covered by Medicare, most of the time it's not. And when you go get that test, they're going to bill $9,000 to $13,000. And when Medicare says we're not paying, guess who the provider goes after? The beneficiary.
Sure.
Now he has to fight this, so he doesn't have to worry about paying that money. So these are the kind of scams that we see all the time. Another big one is durable medical equipment. People are sent braces, neck, back, knee, ankle, just sent to them in a box. Never ordered it, don't need it, not medically necessary. So we get these calls, and what do I do? Well, you can return it to the provider, but we suggest that, number one, you call up Medicare and tell them that you're being billed for these braces that you never ordered, not medically necessary, and never to pay the bill, because really that's a scam, and Medicare should basically try to recover any monies it has paid out. That's the issue that we find. Medicare pays, and then trying to get the money back after we discover the fraud is a lot harder.
Yes.
So we want people to call up their Senior Medicare Patrol program and tell us what problems they're having, what scams they're seeing, because then we can get the word out. We do alerts, and basically we add these type of things to our presentations. And, we'll do a presentation anytime during the day, anytime at night, any weekend. The same thing with your Senior Medicare Patrol. All you have to do is call them and say, you'd like someone to come out and do a fraud presentation for Medicare. In October and November, I just looked it up, we basically did 64 presentations in 2 months.
Oh, wow.
That's a lot, And when you think 1 week is a holiday for Thanksgiving, which we don't do any, that's a lot of presentations, but we're happy about that. We want to be kept busy. one of the things about this job that I like is that I'm on the road a lot, visiting senior centers, community centers, private clubs, senior groups. And basically they invite us all the time to give a presentation to their group so that basically they won't be cheated. Because right now, I hate to say it, but Medicare estimates that by 2031, which is only 7 years from now, that they might not have enough money to pay out 100% of the Medicare claims that are covered under the Medicare rules. So what would happen? Well, Medicare will become more expensive. I don't know all the details yet, but certainly if they cannot pay out the money, they need to get more money in. And how do you do that? Well, you charge more for Part B. You may charge for Part A, which is free hospital coverage. You may charge more for Part D. You can basically assume that the cost of Medicare is going to rise if we don't do something to fight fraud, waste, and abuse. So, and the reason, Medicare is running low on funds is because seniors are living longer. And as they live longer, they use more medical services, and they're on Medicare. So Medicare is not getting as much withholdings. When you work at a job, what are the two withholdings? Social Security and Medicare. So if a lot of people aren't working, a lot of people are not paying taxes in for Medicare withholding. So less and less money is coming into Medicare, and yet as people age, they actually use more services in Medicare than less.
So that surely makes sense.
Yeah, it really, really is a big issue, and we're doing whatever we can to help fight it. If you could save even half of $60 billion, that's a lot of money.
Sure.
That's a lot of money, and therefore we can help bolster Medicare because, I'm on Medicare, and I love it. It provides great service. Yes, I have to pay some cost, but hey, at least it's good health insurance. And as you know, if you don't have health insurance, then you don't go get medical treatment.
Well, how would you know you were eligible for Medicare?
Well, Medicare is really, most of the time, based on age. When you turn 65, now remember, Social Security and Medicare are two different programs. Social Security is based on age also, but now, depending on when you were born, when you're 67, you can usually enroll in Social Security. With Medicare, it's always been 65. So when you age into your 65th birthday, you're eligible for Medicare. And Part A, which is the inpatient hospital coverage, is free if you work 10 years. Okay? So when you turn 65 and you basically have worked 10 years, which most of us have, we can go on Medicare. So Part A, if you work 10 years, is free. You have to pay for Part B, which is doctors and x-rays and lab tests. And then, of course, you have to decide what else you need. Do I want to stay in original Medicare and buy a supplement plan? Or, as you see all the commercials with Joe Namath and Captain Kirk, they're selling Medicare Advantage plans. And Medicare Advantage plans are Part C of Medicare. And basically, they're run by private companies like Humana, United Healthcare. So when you're in a Part C plan, you have to go to doctors in the network of that plan. So that's really the big difference between original Medicare and a Medicare Advantage plan. Medicare Advantage plans have a network. If I'm on original Medicare, which I am with a supplement, I can go to any doctor that accepts Medicare. Now, there are other major changes, but that's really the biggest. So, and we want people to understand the rules. So when do you enroll? How do you enroll? Remember, if you don't enroll when you're first eligible for Medicare, you can be penalized. So we want people to know that. We want them, when you first enroll in Medicare, it's called the initial enrollment period. That's 3 months before you turn 65, the month you turn 65, and 3 months after.
Must you enroll? I thought it was automatic.
Well, if you're getting Social Security payments early, then it's automatic. If you're not getting Social Security payments, then basically you have to enroll in Medicare. Now, if you're still working, let's say, like I am, you don't have to enroll in Medicare. You can wait until because you have coverage from your job. So you can wait. When you retire and no longer actively employed, then you have to enroll in Medicare. Because remember, when you're working and you have 20 or more employees in the job is primary. That's the primary medical coverage. Once you retire, Medicare becomes primary, and you have to have Part A and Part B, and then you have to decide, should I stay in original Medicare and get a supplement, or should I use a Medicare Advantage plan? Now, one of the things you'll notice on the commercials about Medicare Advantage plan is that they have all these extra benefits. They might have transportation, safety bars in your home, over-the-counter flex cards to help you buy things. But you have to weigh that against the network, because then you have to only go to a doctor and a hospital in the network. Plus, you may also have prior approval requirements where the plan will say, hey, we're not approving this, we don't think it's medically necessary. So there are big differences between original Medicare and the Medicare Advantage plans. But either way, fraud is the same, whether you're in original Medicare, Medicare Advantage plan. So, people have to sit down and read their statements. If you're on original Medicare, it's called a Medicare Summary Notice. If you're on a Medicare Part C Advantage plan, then it's called an explanation of benefits. But either way, you have to read it. And I hate to say this, but statistically speaking, less than 5% of people ever read their medical statements. And if you don't read your medical statements, if there's fraud in there, you're not going to notice it.
No.
So we encourage people. Another thing we want to encourage, Jeanne, is keep track of your medical appointments. We hand out trackers at our events. And basically what it is basically a calendar. You go to the doctor, you write it down. Take a test, you write it down. And then when you get your statements, whether you're on original Medicare or a Medicare Advantage plan, you compare the two. Make sure you're not being cheated. Remember, this is your health care. This is costing us a lot of money. So anything we can do to help fight fraud, waste, and abuse. And, waste is also a big component. Give you an example. Let's say I go to a doctor, and he's worried about being sued for negligence. Well, he orders all these tests. Maybe half of them are not really medically necessary, but he wants to protect himself. So you see a lot of waste in the system also because of tests that are really not medically necessary. Anything like that, we should report it also, because it really, doing these other tests and services that are not medically necessary adds to the cost of Medicare. So now, of course, it's very difficult for people because, their doctor says, I think you need this test. What are they, it's hard for them to say, oh, no, I don't need this, doctor. So it's a difficult problem. And that's why we always say, if you're doing major surgery and it's being ordered by your doctor, well, maybe you should get a second opinion. Because it can hurt. I try to get second opinions, nothing for minor things, but for major things.
Sure.
If I'm unsure and I'm a little worried, well, go to another doctor in the plan or in original Medicare and ask him, hey, doctor, I need this. And if you get the same answer, okay, fine. At least then you're comfortable getting these additional services. So
right.
It's really, really, difficult. And, Medicare, I hate to say it, is a complicated program. There are a lot of rules. There are a lot of enrollment periods. Other than the initial enrollment, every year, if you didn't go in the first time, there's a general enrollment period. There are special enrollment periods. There are Medicare Advantage enrollment periods. So the rules about penalties and when you can have other insurance and not be penalized until you retire, all these rules are not known by many people, and because of that, they suffer. So I also want to recommend that when people are turning 65, every state has what's called a SHIP program, called SHIP, just like a vessel. But it stands for State Health assistance program. And the SHIP program in every state, I think in New York it's called SHINE. But if you need to sit down with somebody because you're getting close to Medicare and find out what your options are, you should do that. Don't rely on commercials. Don't rely on your friends and neighbors. Oh, I'm in this plan. It's wonderful. It works for me. But everybody is different.
Sure.
Everybody has different conditions, different medical history. So just because your neighbor who loves his plan is in it doesn't mean it's the best plan for you.
Right.
You know, you have to sit down with someone who can look up all these plans, tell you what your options are, and let you decide because, hey, this is your medical treatment going forward into the future.
Mm-hmm.
You want what's best for you. And, of course, cost is an issue. You know, if there's a difference between being an original Medicare and being in a Medicare Advantage plan and the rules for each of them. So, you know, you want to make sure you understand your options so that you can pick the best plan for yourself. Now, Medicare, in order to help with this, they have what's called a Medicare Plan Finder. It allows you basically to compare, let's say you're in a Part D drug plan. And every year, you know, these plans change. Well, you can compare Part D drug plans from one year to the next to see whether you should switch. To give you an example, you know, I was in the Humana Walmart plan because it was the best for me when I did my comparison. But this year, I found a better plan. So I switched my Part D drug plan to another plan, which started January 1st. Because why should I spend more money on drugs than I have to? Why should I spend more money on services? And you can compare Medicare Advantage plans also. You know, all these plans offering all these additional benefits. Well, what do you need? Let's say you don't drive. Well, maybe you should get a Medicare Advantage plan that gives you transportation to and from your doctor, depending on how many you need over a period of time. Maybe you're frail and you need safety bars in your home. Well, there are some plans that will offer that. Maybe you're in the hospital and you come out. Well, some plans have Meals on Wheels when you come out of a hospital. So all these additional benefits, by the way, which are not available in original Medicare, there are more and more people are now enrolling in Medicare Advantage plans. Right now, they say that more than half the people enrolling in Medicare for the first time are enrolling in Medicare Advantage plans because of all these extra benefits. Another benefit, you know, is there's a flex card or an over-the-counter card. But you have to look up and see, well, what are you allowed to spend it on? A lot of times it's medical, over-the-counter medical, let's say aspirin or diapers or something like that.
Mm-hmm.
Sometimes they'll offer cards which allow you to spend it on rent or utilities. So, and, you know, people ask, well, how can they afford this, all these Medicare Advantage plans? How can they afford all these other benefits that are not in original Medicare? Well, the reason they can afford it is because Medicare pays the Medicare Advantage plans a certain amount of money every month for you to be in the plan. And we're not talking chicken feed. You know, we're talking minimum $1,000, $1,300 a month. So every month you're in a Medicare Advantage plan, they get paid that money. And let's say you go a month without using medical services. Well, they keep the money. It's total profit because they haven't spent a dime on you, even though you have been given money by the government for the plan because you're in that plan. And people don't realize that. So a lot of these companies are now offering more and more benefits, and they're getting very competitive because it's such a profitable program. Medicare Advantage plans are probably the most profitable program for private health insurers in the country. And they make billions off these plans. So knowing what's best plan for you is the key to getting the right plan. And remember, every year there's something called the open enrollment period. October 15th through December 7th is Medicare open enrollment. And during that period, even though I'm already on Medicare, I can make changes. If I'm in original Medicare, and I said, gee, I can use some of those benefits in a Medicare Advantage plan, well, I can switch from original Medicare to a Medicare Advantage plan. If I'm already in a Medicare Advantage plan and I've done some comparison, I say there's a better plan for me out there. It's cheaper. It gives me more services. Well, I can switch to another Medicare Advantage plan. Or if I'm in a Medicare Advantage plan, I can go back to original Medicare. So you have all these rules and all these options and all these benefits, but you have to compare them. Otherwise, you're just basically picking something out of the air and hoping it works well for you. So it's something more and more people need to do because I help people during open enrollment every year. I'm also a SHIP counselor in New Jersey. So every year I do one-on-one counseling with people to help them decide whether or not they need to change plans from one year to the next. And remember, Medicare works on a calendar year, so when I change my drug plan, it's effective January 1st and goes through December 31st. And then next October, I will sit down again and I will compare Part D drug plans to see if there's even a better plan out there for me, because I want to spend the least amount of money on my drugs. And as you get older, as we age, we use more and more drugs. So finding the best Part D drug plan is worth your while. Could save you hundreds of dollars. I know when I did a comparison for myself, I couldn't believe it. I said, wow, I can save $400 to $500 a month by switching a Part D drug plan. So, these are complicated choices, and SHIP counselors, which are in every state, are trained in order to help people make these kind of decisions. So, picking the right plan and fighting fraud, waste, and abuse are a big part of a beneficiary's job, And we tell people all the time, it's your money. It's your dollars that are being spent on Medicare.
Yeah. People have a tendency to think it's that somebody else is paying it, that they don't need to be vigilant and informed.
That's right. That's exactly right. If you look at your medical statement and it says Medicare paid X, Y, and Z, you owe zero. Fine. I don't need to read my statement. I'm not paying it.
Yeah, right.
What if there's a service in your statement that you didn't get? Right? Medicare is going to pay it.
Mm-hmm.
And unless you read your statements, you're not going to know that Medicare paid it because you didn't read the statements. And that's your tax dollars going to services that you did not order, did not get, or were not medically necessary. So it's a big part of a job being a beneficiary, knowing what to do and preventing and detecting and reporting Medicare fraud. So we're all in this together. I know I hate to see Medicare become more expensive or less efficient or doesn't cover as much in the future because of this fraud and the cost of Medicare. Medicare, I think after defense, is the second largest budget item for the federal government.
Oh, I didn't know that.
Yeah, it's a lot of money, and fraud is just a typical part of it. So, we could all do our jobs, and we could all basically say, hey, I'm going to step up. I'm going to read my statements. I'm going to keep a calendar.
Are there people who have Medicare who don't know they have Medicare?
I haven't heard of many people who don't know they have Medicare. What they don't know is what they have in Medicare. Are they in original Medicare or are they in a Medicare Advantage plan? And some people are put into plans because, let's say, they have a broker or an agent, and they're not even sure. So when I counsel somebody, I say, what are you in? I don't know. Well, take out your card. Do you have a card from a Medicare Advantage plan? Or do you have original Medicare with a Medigap or a supplement plan? Because you can't help them unless you know what they're already in and what changes should be made. So, there are a lot of people who really don't know that. They know they're in Medicare in some way, but they don't know exactly what they have. So that's why I always start off with that question. Well, what are you in? And and when they tell me I don't really know, well, that's problematic, isn't it?
Well, tell me something. If somebody wanted to get in touch with you, what would they do?
All they have to do is call me.
Okay, what's the number?
The number here at the Jewish Family Services of Middlesex County, where I'm located, is 732-777-1940, and just ask for Charles Clarkson. Or they can email me, which is my first name, Charles, with the letter C, Charles C, at J as in Joy, F as in Frank, S as in Sam, Middlesex.org. So it's Charles C at JFS Middlesex.org, and I'll be happy to respond. And if I can't help them, I certainly will find someone who can help them and make a proper referral. And what we do is, when we get fraud cases, let's say someone calls us and is reporting fraud, well, we do an initial investigation, try to determine if it's fraud or if it's just error or abuse, and then we put it into a database, and we can refer those cases directly to the Office of the Inspector General, which oversees Medicare and is supposed to fight Medicare fraud.
Oh, that's wonderful.
Yeah.
My goodness, Charles, that's just and when I'm not saying this, and I hope you believe me, and I'm sure you do, but I don't think the average person knows there are people and persons like you that will take the time and the opportunity to speak to us and to inform us as to what our rights are and what we can do to keep.
Yeah, well, like I said, we're the best kept secret in the government, the Senior Medicare
Yes.
Program.
Yeah, it's like a best kept secret, and that's
and we're free.
I mean, that's wonderful. Well, what I want to say to you is that just to meet you and to say thank you, and then to say goodbye to you, that's one thing. But I'm going to say to you, I'm going to be calling on you from time to time
to
come
please.
back and say something else to us again. I find you very valuable. I mean, I don't know. I'm ready for Medicare, and so it's something that I could certainly use the knowledge. And there's something about what you were saying today that I realized. There's so many facets of our lives that we take for granted, and when it's time to use them, we again take it for granted. Oh, I'll find that out later. I'll do that later. I'll do that.
Yeah,
and
right.
It is so important, and to have someone like you that we could call upon, I think is just absolutely fabulous. I want you to know that Harlem Community Radio is very, very, very happy that you have shared with us the information about Medicare. And please, 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 please keep in touch and remind us, because every 6 or 7 or 8 months we need to know.
Yeah, of course. And I would recommend to you that, during the next open enrollment period might be a good time to interview me again and say what's changing from year to year. Every year Medicare changes, Medicare Advantage changes, and
when is it?
That's between October 15th and December 7th of each year.
Oh, okay. All right. Well, why don't you do this with that? Why don't you call and remind us?
Okay, we'll do.
And I will definitely, because something as basic as Medicare, people take for granted. Oh, I don't need it. When I get other, but that's very, very, very important.
Absolutely. When you find out when you need it is when you get really sick.
Sure.
Do the proper with your enrollment, or you didn't pick the best plan and you're hospitalized, and all of a sudden your costs are going through the roof because, oh my God, I didn't know what I was doing and I want to go back to original Medicare. Well, you might not be able to do that. So it is very difficult, and knowing the rules is half the battle.
And is there an age that goes along with it?
If you're 65 is when you're first eligible for Medicare, unless you're disabled or you have like a Lou Gehrig's disease. And there are
yes.
There are certain exceptions. If you're disabled and are ruled disabled by Social Security, then 2 years after your permanent disability, no matter what age you are, you can go on Medicare. But for most people, basically they're working, and when they turn 65, they enroll in Medicare.
Well, I think you've just been so wonderful this morning what I must say to you is that you will hear from us again, and we'll wait. And if you don't, call me and say, Jeanne, don't forget, it's time I re-inform them.
Okay, we'll be happy to do
about
that.
Medicare.
I want to thank you for reaching out to me and letting me speak and making ourselves available to anybody who calls us or emails me. This is what I do, and I like doing it. I think I'm good at it.
Oh,
so,
you are. You're wonderful.
No problem.
All right, so I would love to hear from you now.
Okay, will do.
Your name is Charles what?
Clarkson, Clarkson.
All right, okay. So you're a part of our family now, Charles Clarkson.
I'll be happy to be part of the family.
Okay, thank you.
Okay.
And we'll be talking to you soon.
All right, thank you very much.
All righty, bye-bye.
Bye-bye.